welcome to Mera Doctor. I'm Kiran. I've got Dr. Shashidhar BK, a fellowship trained consultant spine surgeon who's traveled around the world. Welcome, doctor. So today we will be talking about osteoporosis. So doctor, what is osteoporosis?
To know osteoporosis, we should first know what is the normal bone structure. As you know, normal bone structure is made up of scaffolding of calcium and mineral, which are densely packed. So they're densely packed till the age of 30-40 years. The bone has a usual strength. As we get older, it's a natural process. This dense packing is lost.
Okay.
There is a balance between the formation of the bone and the destruction of the bone, always going on in our body. Our bones are not the same between any 2 years.
Okay.
What your bone is today will not be the same next year. There is always a remodeling happening.
Okay.
After a particular point of time, the remodeling is not functioning up to the level and the bone starts to weak.
Okay.
The density is not there anymore. The close scaffolding of the bone, of the calcium and minerals, is now drifting apart.
Okay.
There are spaces in your bone. Porosis means there are gaps, there are holes in your bone.
Okay.
That is known as osteoporosis. That is weakening or porotic structure of the bone after a particular age.
Okay. So, what are the different types of osteoporosis then?
Broadly, we can classify into primary and secondary type of osteoporosis. Primary is obviously when it is happening through age and there are no other causes for osteoporosis, which is the most common variety after 50 or 60 years age. When it goes beyond 60, 70, we call it senile osteoporosis. A secondary osteoporosis is when the bone formation or the bone destruction is affected by other factors. For example, if you are on steroid intake, steroids are known to make the bones weak.
Okay.
That is secondary osteoporosis. If you have any other diseases related to your other organs, thyroid, they can cause weakening of the calcium structure. That is thyroid related osteoporosis. If you are on any medications, particularly medications related to epilepsy, such medications can cause weakening of the bone. If you are on, let us say, you have had a cancer and then you are on hormone replacement therapy, certain hormones which you use, they can affect the quality of the bone, decrease the quality. That is medicine related osteoporosis.
Okay.
Primary osteoporosis, where we cannot find any cause, it is more related to the age.
Age.
Secondary osteoporosis is outside factors which may or may not be corrected, which can cause osteoporosis.
Okay. And then who is more prone for osteoporosis?
Yes, studies have shown that females are more prone to osteoporosis. People who are very thin built or people who are very obese are prone to osteoporosis. Lifestyle choices like smoking, alcohol also influence osteoporosis. So if you're a smoker and if you're an alcoholic, having more than 2 drinks a day or a few packs of cigarettes a day, there's a definite chance you'll have osteoporosis when compared to a normal individual.
Okay. And then does that mean that there is a relation to menopause when we look at osteoporosis?
Yes, there is a definite relation to menopause. Particularly the estrogen hormone in women has been found to augment this remodeling capacity. The bone building capacities are augmented by the estrogen hormone. When you have menopause, these hormones are shut down. The support system is not there and the process of bone destruction continues and they are more prone to osteoporosis when compared to men. 70 to 90% of the patient population we see in our clinics are usually women with osteoporosis.
Okay. So we spoke about lifestyle, some of the elements like drinking and smoking which will affect. What other aspects of lifestyle does affect osteoporosis?
Yes. So weight bearing exercise, aerobic exercise have been definitely found to be correlating with less chances of osteoporosis.
Okay.
Even if you have osteoporosis when you are 60, 65-year-old, weight bearing exercises have been known to delay further progression of the osteoporosis. So apart from smoking and alcohol, drug intake, probably exercising daily is one thing which you can do to maintain your bone stock. So if we have to know that by the time we are 30 years of age, our maximum capacity of bone density has already reached.
Okay.
We call it the peak bone mass. You're not going to accumulate any higher level up after that age. So it is very important that when we talk about osteoporosis, we talk about that to the adolescents, the teenagers or children, and make sure they have a good diet, rich in calcium, rich in vitamin D. They are taught and they developed a habit of exercising every day, maintaining flexibility, so that they reach a good peak bone mass.
Okay.
And then the inevitable is going to happen. You're going to get osteoporosis, but your chances are going to decrease.
Okay.
So the prevention of osteoporosis is actually the thing which needs to be addressed at the adolescent or the teenage or young age, not after you're 30.
Okay. So it is better to ensure we hit the right peak density mass so that we can delay the osteoporosis, which will invariably happen with age, which is a complication which can happen, but at least we will ensure we delay it as much as we can.
Yes, if you're lucky enough to live till 60 and 70, you are going to get osteoporosis.
Okay. And what is the role of calcium and vitamin then? And what about some of the other preventive measures with medication or anything like that?
Yes, so calcium and vitamin D are the building blocks. Calcium is the building block. Vitamin D is very essential for utilization of the calcium. So vitamin D is usually produced by the sunlight. Particularly the morning 10 a.m. to 1 p.m. time is where the ultraviolet rays specific to vitamin D are there.
Okay.
And most of us are sitting inside our offices in an AC controlled environment during that time. Very unlikely that we will get that exposure. So when you don't have that exposure, you are prone to vitamin D. So when we routinely do a check of vitamin D in people having back pains or come in contact with us, that's a good opportunity to correct that. So vitamin D correction has to be done in most of the adult populations that we see.
So doctor, what is the role of DEXA scan and other investigations to identify osteoporosis?
Yes, you don't have to identify osteoporosis because it is going to be there. In a 60-year-old, 70-year-old, there is going to be osteoporosis. But there are certain indications where it needs to be quantified.
Okay.
And that is due to the fact that we can correct it, we can prevent the progression. The recommendations are if you are more than 65-year-old, postmenopausal, if you are more than 70-year-old male, you should get a DEXA scan done.
Okay.
The age can be brought down to 55 years old in a woman or maybe 60 years old in men if there are other factors which can be associated with osteoporosis. Like if you are having a low body mass index below the normal range, if you are on medications which can cause osteoporosis like the epilepsy medications, if there are other risk factors like thyroid, if you had early menopause, people who had menopause at 40, 45 years need to get scanned at 55 years.
Okay.
That is because we can intervene. Osteoporosis is silent till it hurts.
Okay.
Yes, you would not know that you have osteoporosis, but the day it hurts, you're going to break a bone.
Okay.
Most commonly, the spine, hip, or wrist. So we should not wait for that.
So it's sometimes very late by the time we really get the pain.
I would say most of the times.
Okay.
Most of the times, people are coming in touch with us when they've already had an osteoporotic fracture.
Okay.
So we can prevent it. So when it is silent, when it is still not reached that stage, people have usually back pain, neck pain, which cannot be explained due to other reasons. They sit for longer duration, stand for longer duration, they feel tired, and they have these factors which I told you, the age, the other factors. We tend to scan and see the quality of the bones.
Okay. So what about DEXA scan specifically? How does that help?
Yes. So DEXA scan is a versatile scan. It can tell you that there is osteoporosis. It can also tell you the grading of osteoporosis.
Okay.
So there are two scores here. We are comparing the bone of the patient who is 60 or 70 year old to the bone quality or density of a patient who is 30 year old.
Okay.
So 60-year female is compared to a 30-year female. That gives us one score. Based on that score, if it is 2.5 standard deviations outside, the expected for the population, we call it osteoporosis.
Okay.
We have a similar score where it is compared to someone of your same age. That tells us how you are accelerating compared to someone of
Somebody
your
else.
age.
Okay.
Now, based on this, recently we have also been able to tailor the treatment also.
Okay.
So if you are having a severe osteoporosis of maybe -4 standard deviations outside, you can get newer treatments, hormonal treatments, which tend to decrease the progression of osteoporosis. If you are -2.5, you can get regular treatments.
When we talk about the treatments itself, what are the different types of treatments? Is this something where it's mostly non-surgical kind of treatments, or are there some surgical solutions also?
As I mentioned, regular treatment. So surgical, non-surgical. Osteoporosis per se doesn't need surgery.
Okay.
The complications happening due to osteoporosis, which are fractures, may or may not need surgery based on the individual situations. Now, when I said regular treatment for osteoporosis, these are the medicines which have been known to prevent the accelerated destruction of the bones. So, let us say if your score of on DEXA is -2.5, there are medicines like bisphosphonates, strontium, other such group of medicines which can be given on regular intervals to prevent that accelerated progression. We have safety data up to 5 to 10 years for them.
Okay.
Now, if your DEXA score is -4.5, then we give medicines which can build the bone density.
Okay.
There are newer medicines which are coming up which can help in that. Now, if you have a complication, which is a fracture, if it is a hip fracture, it's quite disabling and you have to be in your bed. Most of the times it leads to a hip replacement surgery in that age. If it's a wrist fracture, not so disabling, not much of displacement, most of the time people end up in a plaster for a classic Colles fracture. Now, spine fractures, they have pain. If they don't have any disability, no weakness, we wait for 4 to 6 weeks. If the pain doesn't respond to rest and activity limitation, then we go for cement augmentation.
Okay.
What we call as vertebroplasty or kyphoplasty, which is mostly a pain relieving procedure.
Okay. Right. Thank you, doctor. I think we've covered osteoporosis here. Thank you, viewers.
Thank you.